Hi, I'm Dr. Sharbell Hashoul, and today I want to help make sense of one of the most confusing words in a breast cancer pathology report: margins. If you've had surgery and your report mentions clear margins or closed margins, this video will help you understand what that actually means. Let's start with the basics. When a surgeon removes a breast tumor, whether through a lumpectomy, which takes out just the tumor and some surrounding tissue, or a mastectomy, which removes the whole breast, that tissue is sent to a lab. There, a pathologist, a doctor who studies tissue under a microscope, examines the edges of what was removed. Those edges are called the margins. Think of it like cutting a slice out of a cake that has a raisin baked into it. You want to make sure you cut around the raisin with a little extra cake on all sides, so no raisin is peeking out at the cut edge. In this analogy, the raisin is the tumor and the margin is that border of normal tissue surrounding it. When the pathologist looks at those edges, there are generally three possible findings. The first is a negative or clear margin. This means that when they examined the outer edge of the removed tissue, they saw only normal healthy cells there with no cancer cells right at the border. This is generally the most reassuring result because it suggests the tumor was likely removed completely with a rim of normal tissue around it. The second possibility is a close margin. This means cancer cells were found near the edge, but not actually touching it. How close is too close can vary depending on the type of cancer and specific guidelines your surgical team follows, so this is something your doctor will interpret based on your specific situation. The third possibility is a positive margin, meaning cancer cells were found right at the very edge of the removed tissue. This suggests there may still be some cancer cells left behind in the breast. It doesn't mean the cancer has spread elsewhere in the body. It simply means more tissue may need to be removed to get a clear margin. This is a fairly common and manageable situation, and your surgeon will usually discuss options such as a second surgery to remove a bit more tissue. It's worth knowing that margin status is just one piece of a much larger picture. Your care team also looks at the size of the tumor, its grade, whether lymph nodes are involved, and other factors together to guide next steps. A close or positive margin doesn't mean something went wrong with your surgery. It simply reflects how the cancer was growing in that specific spot, which can be unpredictable and isn't something anyone can control ahead of time. Here's a practical takeaway. If you're waiting for a pathology report or you've just received one, it can help to write down the specific words used for your margins and bring that list to your follow-up appointment. Ask your surgeon or oncologist to explain what those particular words mean for your specific case and whether any further treatment or surgery is recommended. Understanding the language of your own report can make those conversations feel less overwhelming. Margins are simply a way of checking the edges of what was removed to help guide what happens next. As always, if you have questions about your own results or symptoms, please bring them to your doctor who knows your full picture and can guide you best. Thank you for watching and take care of yourself.